We now have the capacity for 161,000 tests a day. And because of that increased capacity, I can announce that we're expanding eligibility yet further. From tomorrow, we're expanding eligibility for testing to include the under 5s, so that now every single person who has symptoms of coronavirus can get a test, no matter their age. And what's more, to make NHS test and trace as effective as possible, it is very important that everyone with symptoms must isolate immediately and go and get a test. Now, I want to thank and pay tribute to everyone who's been involved in making this big project happen. Dido Harding, who's led the work, the technicians in the labs who've been making mass testing a reality, the contact tracers manning the phones, the healthcare staff providing the expert advice, and the companies who've helped us put it all together at a record scale and pace. And what really matters is this: to protect your friends and your family, testing and tracing must become a new way of life. This is being launched today in England. Northern Ireland already has a system in place, and my colleagues in the Scottish and Welsh governments are working to bring in a system as soon as they can. All 4 nations have been working together to make sure we have systems that are coordinated across the whole country. And the instructions to people are clear. If you get symptoms, isolate immediately and get a test. If you are contacted by NHS Test and Trace, instructing you to isolate, you must. It is your civic duty. So you avoid unknowingly spreading the virus, and you help to break the chain of transmission. This will be voluntary at first because we trust everyone to do the right thing. But we can quickly make it mandatory if that's what it takes. Because if we don't collectively make this work, then the only way forward is to keep the lockdown. Put better, the more people follow the instructions, the safer we will be, and the faster we can safely lift the lockdown. So do it for the people you love. Do it for your community. Do it for the NHS. And do it for all those frontline workers who've done so much and gone out every day to put themselves at risk to keep you and your family safe. And in return for following those instructions, you'll have the knowledge that, when the call came, you did your bit at a time when it really mattered, when the whole country, who are desperate to see their families, were counting on you to do the right thing. You did your bit to bring us all closer together and closer to the day when we can be reunited. This system will start tomorrow morning at 9 a.m. And the first people who will be contacted will be the people who received a positive result today. This is a very distinct change on our approach, and I just want to take a moment to recap the extent of the change. Before today, we said isolate to anyone with coronavirus symptoms in their households. This remains vital. From 9 a.m. tomorrow, in addition, if you are contacted by an NHS test and trace advisor advising you that you must isolate, then you must do that whether you have symptoms or not. Now, I also know that for those without symptoms who receive that call, I fully acknowledge that this is a big ask and that you're going to make a sacrifice. But it's for a purpose, and the purpose is the safety of everyone. Because we know that you can have the virus and spread it to other people without ever having symptoms at all. And it's not just the safety of all, but the liberty of all that is at stake here. We're only in a position to be able to reopen primary schools and outdoor markets if they're COVID secure this coming Monday because we've flattened the curve and now we have this system in place. And in the coming weeks, we will gradually and very carefully move away from a lockdown that's national in scope, blanket in application, and start moving towards a system that's much more targeted in scope and focuses local action on tackling local flare-ups. This will help us restore some of the basic freedoms that matter so much to people, and doing some of the things that people are yearning to do, like seeing friends and family, booking a holiday or getting a haircut, all the while controlling the virus and keeping people safe. It's a brand new service on a scale never seen before. There will be bumps in the road, but we will constantly improve it. And in the weeks ahead, we'll ramp up the service still further. And once the system's bedded in, we'll roll out the NHS contact tracing app that is being piloted in the Isle of Wight. And of course, NHS Test and Trace is only one part of the answer. It's not the whole answer. All the action we're taking to get R down and keep R down, it all requires us to keep doing the right thing. Testing and tracing will help us to hunt down this virus. It's one of the tools with which we can finish the job, and we all need to play our part. So please, stay alert, control the virus, and save lives. I'm now going to ask Baroness Harding to set out some more of the details of NHS Test and Trace, and then Professor Van Tam to take us through the daily statistics.
Thank you, Secretary of State. This is a brand new service which has been launched at scale in a very short space of time. And as the Secretary of State has just said, we all have a part to play, and it will only succeed if each of us does our bit. I want you to feel safe and confident to play an active part in NHS Test and Trace, for you, your loved ones, and our country. We do need you to follow the following 3 steps. Step 1. If you have one or more of the symptoms of coronavirus, a fever, a new continuous cough, or a loss of your sense of taste or smell, you must immediately self-isolate. Step 2. You should then book a test on the nhs.uk/coronavirus site, or if you don't have internet access, by dialing 119. Do not leave home for any other reason. If you test positive, you will then be contacted by the NHS Test and Trace service within 24 hours. All contact tracers have been undergoing training and induction before the beginning of this week and before they start work. Step 3. NHS Test and Trace will help you establish who you've been in close contact with and so who you might have infected, and will gather their contact details. This could include members of your household or someone you've been within 2 metres of for more than 15 minutes. You will also be given clinical advice and support for dealing with the disease yourself. NHS Test and Trace, in turn, will get in touch with those contacts. So if you've been exposed to an infected person, they will be in contact with you. You will then be instructed by the NHS to self-isolate for 14 days. Even if you don't have symptoms or you feel perfectly well, you need to follow these instructions. This individual and collective effort is vital if we're to keep the rate of infection down and carefully lift the lockdown. We're working hand in hand with communities and local authorities to make sure that you have the support you need to cope when you are self-isolating. This is why the government announced last week it's giving £300 million to local government to support this on the ground, tailoring support in response to your local needs. Over the past few days and weeks, I've spoken to a huge number of people, and I've heard real support and a desire to make this work. We all want to get back to a more normal way of life, and this is an important step on that journey.